so please.
Thank you. Good afternoon, everyone. I'm happy to speak about impact of clinical expertise and the choice of smart device on accuracy to detect atrial fibrillation via single-lead ECGs. So I have no conflict of interest to declare, and let's start. Since 2020, smart devices or single-lead ECGs that are 30 seconds or longer are allowed for atrial fibrillation diagnosis. And smart devices often come with an automated rhythm classification automated classification. And there are an estimated over 210 million users of smartwatches worldwide this year. But the problem is with this automated rhythm classification that around 20% are inconclusive and manual interpretation is needed. And the other problem is if manual interpretation is needed, there are several different smart devices. Each has a different curve, each has a different design and other processing. So our aim was to compare or to see how the clinical expertise influence the accuracy to correctly identify atrial fibrillation with this smart device generated single-lead ECGs, and if there's a difference between the smart devices. How did we do that? We made an online survey and distributed the link for the answers. And inclusion criteria where they had to be 18 years or older, they had to provide online informed consent, and they had to be medical personnel, so medical students, residents, or specialists. And the quiz consisted of, included 10 patients, 5 had atrial fibrillation, 5 had sinus rhythm. We recorded 5 single-lead ECGs from each patient with 5 different smart devices. So in the end, we had 50 different single-lead ECGs. The participants could classify or rate them in blocks of 5, so not all rated all 50 single-lead ECGs. The possible answers were sinus rhythm, atrial fibrillation, or inconclusive. And inconclusive with the intention to diagnose, we sorry for the words, we counted them as false negative or false positive. So we used the following 5 smart devices: the Apple Watch 6, the Samsung Galaxy Watch 3, the Withings Scan Watch, the Fitbit Sense, and the AliveCore Cardio Mobile. And we made a comparison between cardiologists, internal medicine residents, and medical students, as well as between the smart devices, previous ECG knowledge, and preference in single-lead ECG design. Here's the baseline data. As you can see, females were represented with 55%. The median age was 27, so rather young. 21% had previous experience with single-lead ECGs. In the cardiology, specialist cardiology, there were 69%, so 30 had no experience. And the average looked ECGs per week were around 1 to 25. So overall, we had 450 participants, which rated 10,865 single-lead ECGs. The overall median accuracy was 64%, and a rather large amount of 22% were labeled as inconclusive. Here you can see that the accuracy to correctly identify atrial fibrillation via single-lead ECG is significantly dependent on the level of expertise. But if you look at the sensitivity and specificity, we see that bachelor students only had accuracy of 50%, so not better than a coin flip. But interestingly, specialists in cardiology weren't so good either. They only had an accuracy of 81% and a sensitivity of 72%. And if you look at the different smart devices, we could not find a significant difference. So it doesn't matter which smart device the ECG was. But if we ask the participants if they had a preference in design, well, there was some tendency seen. But even though there was no significant difference between the smart devices used, we could see that if someone had a preference in a certain design, they were better regarding that design, vice versa. So if they disliked design, they had a worse accuracy. So to conclude, single-lead ECGs can be very difficult for interpretation and challenging to classify. And the clinical expertise plays a role on the accuracy. And the choice of smart device doesn't seem to play a role, but the preference in design could influence the personal accuracy. So thank you for your attention.
Yeah, thank you for this interesting data. So any questions? So my question is, what was your gold standard for AFib? So do you had a 12-channel ECG of the same episode, and that's your gold standard, or do you have an echo? Or?
No, exactly. It was a 12-lead ECG we made right before the 5 single-lead ECGs.
Okay, thank you. Yeah, one question, Luella.
So based on your study, which smartwatch should I buy?
That was very clear, I think.
Well,
can we talk about that in the break, please?
Sure.
So okay.
Okay, thank you.
Okay, one final question.
Okay.
Sorry.
I'm sorry.
What kind of implementation could be done to smartwatch to reduce the number of inconclusive measurements?
Well, with the new coming AI, that's a good point. So we're also working with an AI algorithm, and with that, the inconclusive rate is way lower.
Okay, thank you.